Good evening. I am Felina Kusinababan, a student from Geography Education, Faculty of Social Sciences, State University of Medan. I want to interview a nurse to fulfill a lecture assignment, and I'll leave it to sister to introduce herself briefly.
Good evening. Thank you for the time you have given me. Okay, first of all, let me introduce myself. My name is Katrina Octavia Xiongbin. I'm a nurse at Puskesmas in Lubuk Pakam area Medan. I've been a nurse for 4 years. Okay, I return into Sister Felina.
All right, I'll start this interview session. First one, what do you find difficult about being a nurse?
I think the most difficult part of being a nurse is when I have a patient that is very unhappy or in a lot of pain. I can comfort them to that degree I like to. I keep a dialogue going with the attending physician so that she has as much information as possible regarding the patient pain level. Sometimes the patient does effectively communicate with the doctor, and I try to help bridge that communication gap.
Do you prefer to work alone or as a part of a team?
That depends on the circumstance. I enjoy being part of the treatment and support team, but I also like the autonomy of working alone.
Okay. How will you handle a patient who complains constantly of pain?
Okay, I will listen simply to the patient complaint and reassure him that his concern were being heard and that we were doing everything possible to help. If it seemed ultimate, I'd confer with the attending doctor to make sure that patient pain was being managed in the most effective way.
What do you contribute to your patient as a nurse?
I feel that my patient know that I'm there to provide comfort and understanding, that I will listen to their concern, and that I will act as their advocate if necessary.
How do you respond when family member asks for your personal diagnosis?
Unless it's my role to dialogue, I would do so, but I would try to dig in a bit the figure out why the patient family member was inquiring. Just the person need some validation. Did the doctor not explain to promise carefully? I seek to the helpful and share important information without stepping outside of my role.
What interests you about working here?
I'm impressed with the model here and the collaborative spirit of the team. Just by sitting in the waiting room, it's clear me that this practice has a patient first priority. I'm eager to work with people who are passionate about care.
What made you choosing nurse career?
Nurses have such a powerful role in the hospital. I saw that firsthand when I was young and had a family member in the hospital, and it made me determined to pursue the career. Helping people during a difficult moment is tremendously meaningful to me.
How do you handle stress on the job?
In the moment, I don't need to feel the stress. I'm too instant to provide care to the patient and offering support to doctor and team around me. Later, through sometimes it's me. My strategy is to go for a hard workout when the stress does dissipate over time.
How will you deal with the doctor who is rude?
Everyone has bad days. If the rudeness is a one-time occurrence, I let it go. If something major happens, or if it's repeat, I reach out to my superior. My concern will be that perhaps the doctor was going to not because of a bad day, but because of dissatisfaction with my work.
Okay, for the last, what do you find most rewarding about being nurse?
As a maternity nurse, I'm there for the moment when people family grow. It's powerful and our spirit to witness. And I'm so happy to be able to resource and help women in this big moment, especially first time moms.
Thank you for the time you have given for this short interview. I wish you more success in your work. And for the last time, I say thank you so much.
Okay, I also thank you. And I hope you are also successful in being a good student for the future. I'm allowed to leave this room. See you next time. Elena, see you.
See you.